Guys, I have Dietrich from Skinny Medic channel, which is Medical Gear Outfitters is their website. Dietrich's been a paramedic for 19 years.
Getting old.
Yes, you are. Instructing, doing a lot of instruction, and I mean, just really has a lot of experience. And so one of the things that we want to talk about today particularly is your trauma kit. Now, not just the trauma kit. This is something we carry portable, right?
Yep, this is like an IFAK, individual first aid kit.
And so this is something that, you know, to me, especially with the range or, you know, even in your vehicle if you just want something. But we're going to look also at putting together a trauma kit for preppers for your home, which I think this is a pretty cool setup.
Yeah, we're kind of expanding this from the IFAK up to a little bit bigger kit, but we can also break that back down and kind of give you some ideas for building your IFAK as well.
Now, another thing that Dietrich does is he does classes, stop the bleed classes, and different trauma classes. In fact, I've attended about 4 of those, and they are top-notch. So we're going to have his information down below, but of course, obviously, if you're looking for training as well, and I highly recommend it.
All right, so when you're building your trauma kit, you need to think about the MARCH algorithm. This is massive bleeding, airway, respiratory, circulation, and heat loss. So if you're picking out your items you're looking for an already pre-made kit, kind of think about that, and getting all of those bases covered is a great idea for your trauma kit. Now, stop the bleed kit is exactly what it means. It's just to stop major bleeding. But this is a true like home trauma kit that's going to be for the range, things like that. Not something you're going to carry on your vest, but something that's in a backpack, a little bit bigger kit.
And two, with kids at home or with people that, you know, you may not be able to get medical help there in time, and having these things could save your life, and then possibly not having any medical help.
Correct, because you can bleed out in 3 minutes from your femoral artery. So by the time you get on the phone, get 911, get the police there, get EMS there, the person is dead. So thinking about massive bleeding, starting out with, we have 2 tourniquets here. There's a bunch of tourniquets on the market. I just picked the 2 that are probably the most popular ones. The CAT tourniquet, this is a Gen 7. This is the newest generation from TechMed Solutions, the Soft T. Really like this one because of the buckle here. It's got a new upgraded buckle. It's a lot smoother. I like it. So then, tourniquets are for arms and legs, major bleeding. Then we can use combat gauze or C-locks here for like junctional injuries. Now this stuff does get expensive, so if you can't afford the C-locks or the combat gauze, you could just use some regular compressed gauze there in your kit. But combat gauze or C-locks is a great option there. Another option for major bleeding is pressure bandages. There again, the 2 most popular ones are going to be Israeli or the Elias pressure bandage here. I like both of these, they both work well. So then we have all of our items for major bleeding here. We can control major bleeding on the arms, legs, and inside like the armpits and the groin. Then we move to airway. We want to be able to control someone's airway. If they can't cough, we want to make sure we can control that for them. So an MPA in the nose. I assume we're going to do that in a few minutes for you.
Sure, you're going to do that.
Yes. This one is a pre-lubricated one, so I like that one as well. That's we've added this to all of our kits. You don't need the KY, the extra lube for it. We have a tactical turkey baster here because someone's going to puke or they have a head injury, they're going to vomit, so we can suction it out here. It makes it great for clearing the airway. You could also just log roll them and put them in a recovery position if you needed to.
And this has a bag that comes off the end there.
Correct. So the puke, blood, vomit goes into here, goes down into the bag, and stays right there.
So now, where's the barf bag? Because I'm going to need that.
Yes, that's in our other kit we talked about. So then we got massive bleeding taken care of. We've got airway taken care of. So then we'll move over to respiratory. So this is where we need, if someone's not breathing, we need to breathe for them. So this is an adult bag valve mask. This is the pocket version. So this is what you see on most ambulances. Works great. This one's a pocket one. It's the same thing, just a lot smaller packaging here. So it is a little more expensive, but room inside your kit is a big deal. Then I would look at this one right here. Also, while we're on the chest, you do not wound pack the chest. You kind of just seal it up and let God take care of it. So we're going to use chest seals here. Vented chest seals is the way to go right now. 2 different options. You have the halo chest seal or the hyphen chest seals. This chest seal has vents in it. It's going to let blood and air come out of the chest as needed. Then for circulation, we usually tell guys to double check because you don't want to miss that gunshot wound that you didn't find the first round. So you went through, you did a sweep, and you couldn't find anything. For this C, for circulation, go back and redo your assessment here. H is for heat loss. So we have 2 different versions of Mylar blankets. We have the regular one here this little small one. And then we have the Blizzard blanket, which is huge. It's a 2-layer one, works great. So either one of these is a good option if you're looking for hypothermia prevention, which is big in trauma. One of the things that is a deadly killer is hypothermia. It means the body temperature drops down. So you used all this equipment on your best friend, and he gets cold and he dies because you didn't have a blanket. And then some extra items we kind of threw in there are gloves. Gloves are expensive right now. No one can find them, so they're kind of expensive. If you can find gloves, they're nice. I like having tape in my kits. This is the Gecko tape. It's tactical duct tape, if you call it that, medical grade duct tape. Works great for using splints, things like that. I really like it. And then a Sharpie to be able to write information down, like a phone number, when you applied the tourniquet, medical problems, medical history, things like that. So it's great for writing information down.
And we're going to have a list of all of these different items down below in the description because I know it can be a little overwhelming. There are some options here. So this doesn't come necessarily as a complete kit, but you can buy them each individually. Is that right?
Correct.
On medicalgearoutfitters.com. And now we're going to look at just an individual IFAK. Now when it comes to IFAK, and Dietrich's going to go over each thing, but this is not just one IFAK. There's a couple of different choices you can make here, but we're going to differentiate that. So I just wanted everybody to kind of have an idea before we look at this.
So taking a look at the tourniquets here, you have the CAT tourniquet here. This is the Gen 7. This is a new generation of soft T from TAC-Med Solutions. These are going to be to control major bleeding on the arms and the legs. This is the latest generation of the CAT. I really like the CAT. I think it's king of the tourniquets, but I also really like the soft T. This is the latest generation here. So you can see it has this triangle indicator here to let you know if it's not pulled tight enough. They've also upgraded the buckle here. It's a polymer buckle now. So it's a lot smoother going on. They have an assist here that helps you get the windlass locked into position. So both these are great choices for our tourniquet.
And I like the metal of the soft T.
Correct.
Like
so
that.
This is a metal windlass and this is a composite over here. Both these are good choices. So thinking about hemostatic agents, these are great for wound packing wounds. So we have Combat Gauze, which is made in America, and we have Celox, which is made over in the UK. Both of these basically take the water out of the blood and make it thicker and help with the clotting process and keep the red stuff on the inside. If you can't afford these, because these are super expensive, you're talking like $45 a piece for these, you could go with some regular compressed gauze here. This is $5 here. So it just means you're gonna have to hold pressure a little bit longer and making sure you're getting it packed extremely tight. So Combat Gauze here is a little bit softer material. You can see the X-ray strip running there as well. It is made out of volcanic rock, basically, and that's what they use to help with the clotting agent. Celox over here is made out of shrimp shells. They take the iodine out of it, which would cause you to be allergic to it, but that's basically what they use here. And that's super simple terms, but that's what it is.
That's pretty interesting, actually. Taking those natural ingredients to be able to, what their properties are to do that. That's pretty cool.
All right, so on this side, we have this Israeli pressure bandage. It has the pressure plate here, absorbent pad. This is the 6-inch version. They make a 4-inch version. They even make an 8-inch version. So it really just kind of depends on what you're used to working with. You put it around the injury. This goes through here. You can pull back and apply pressure on there. The Elias has a pressure cup here. So you put this on top of the wound, and that allows direct pressure on top of the wound here. The advantage the Elias has, open this up, is we have this gauze that's inside of here. So we could use this for wound packing if we needed to. Also, you have a piece of plastic here that can make a chest seal. So I like that. It's a little bit bulkier in the packaging, but it gives you a lot more options when you go to open up and use it.
That's pretty cool.
So now that we have massive bleeding taken care of, with an IFAK, I really don't carry anything for the airway because I'm just going to log roll the patient and put them in the recovery position on their side. So now we can move to respiratory. So this is where chest seals come in handy. We have the hyphen chest seals and the halo. These are both vented chest seals. Vented is really the way to go now. So we have this one that's going to allow the channels, allow for blood and air to vent. This one, the halo, is going to allow blood and air to come out these little holes here on the side. So when you go to put a chest seal on, you want to put a chest seal on from neck to nuts. We don't wound pack the chest cavity. We put a chest seal on it and also rotate and think about the back as well. So then we always put a pair of gloves in there because blood's nasty and I don't want that on my hands, so keep a pair of gloves in there. Once you've completed the March algorithm, so you went through MARCH, H is hypothermia, so pull out your Mylar blanket and cover the patient up. I keep a Sharpie in my IFAK just because I can write things down like phone numbers, medical conditions, the time I put a tourniquet on, things like that. So having a Sharpie is important.
Now these are options, but you do have these kits set aside, especially the trauma kits. You offer the different options.
Yes, we have pre-made kits ready to go on the website, so we can vacuum seal them, or we can put them in like a VanQuest bag, a Maxpedition bag, even a Condor bag. Just kind of depends on what your budget is and what you're looking for. Whether you want to be in a Ziploc bag, vacuum sealed, or you want a pouch, we can pick and choose. And there are already pre-made kits on the website, and you can look through those and figure out what fits your needs best.
And that's at medicalgearoutfitters.com. We will have a list of both the full-size home prepper trauma kit and then the portable trauma kit as well.
Yep.
And guys, I'm telling you, whenever I go to the range, I've always got a trauma kit handy. Sometimes I've got it right there at the table, at the bench. I've got one in my vehicle, and especially when I have others there. But, you know, you come up on a wreck. I mean, there's so many reasons to carry a portable trauma kit.
Definitely. I think you're more likely to use your trauma medical skills than you are a firearm. And we spend a lot of money on our firearms with training, getting the latest, coolest thing, but you're more likely to use your medical kit than you are your firearm.
That's true. And I really appreciate Dietrich for this video. And guys, really get your medical gear set up. And you can also go to Dietrich's Skinny Medic YouTube channel. There's a lot of instruction there. And they do classes. In fact, we've been to a number of his trauma classes, and they are excellent. So go to medicalgearoutfitters.com.
Yeah, I've done videos on all this on my channel, so I'll open it up, show you how to use it, show you how to use a tourniquet, show you how to wound pack. All that's on there. We also do after action videos, kind of taking real life scenarios, and I talk through like how I would treat the patient, how I would walk through it. So those have been super helpful because people get exposed to what real injuries look like.
And you know, it's not black magic once you kind of know some of the basics. And so, you know, really knowing what to do. And so it's really important to go ahead because it could be your child. So you never know when you're going to be the first responder.
Correct.
Be strong, be of good courage. God bless America. Long live the Republic. Guys, when it trums to comma. We're speaking a separate language here. So if the girl looks really good that you're treating, you can get her phone number with that thing.
You write her name down and get her phone number all with this at the same time. You always get their name first.
Then it's mouth to mouth, right?
Yes.
Okay. So something. So. I was going to say something. There was something I was going to say. I asked her, she didn't know. Do you know?
20 miles an hour.
I was going 5 that time. You ought to tell them this is a very special Sharpie that you can only get at Medical Gear Outfitters.
Okay, we'll do that. That's pretty cool.
That's really cool.
Okay.
That volcanic rock is like super cool.
Yeah. Cost me an arm and a leg.
This cost me an arm and a leg.
Hurt a little bit. I'm gonna have enough. Yeah, it was a 4-inch though.
Oh yeah, 4-inch. You know.
Everybody wants a 6-inch.
Is that it?
Yeah, that's all I got, buddy.
Some low expectations there, boy.
That's all I got.
That's all he's got. You know you're gonna tell that on YouTube.
Yep.
It's moving fast for me. Usually it's going about 2. Okay. That's not true. I wish sometimes my brain was going 2 miles an hour.
Down, yeah,
Lord have mercy. Recommend it. What was that?
I was like, listen, I'm like, they didn't start that, did they?
No. He was taking a little pouch and doing this with it like a little pillow.
This is my baby.
Little pillow.
That is your baby.
Well, here's my baby. Here.
Tactical suction.
Wait a minute. Hold on. I don't know what she's like doing this.
She's ignoring us now.
That's fine.
What are y'all saying?
Nothing. Did you say something?
I didn't say a word.